All right, up and running for this week. So, Dr. Mike, we've got some news that we're going to share with our listeners, and that is that we've been teasing for a couple of weeks that we were going to do a bit of rebranding, a little bit of renaming. We've got that now. We're ready to go. Why don't you drop the hammer and share the news?
Yeah, we love Two Bald Bastards, but as we've discussed in the past, we thought that, hey, if this podcast is looking to reach and grow and get to the amount of people that we want it to get to, right, in order to fulfill our life mission of eliminating as much chronic resolved pain as possible, we need a new name. So in basically, we wanted to think about, okay, what does the ideal human being experience throughout the course of their life? And something that we kept going back to is these blue zones, these instances where there are pockets of human beings that consistently live longer than other pockets of human beings, right? With the understanding that somebody who lives till they're 100 years old is a centenarian. So for me, I want all of my patients, I don't necessarily know if I want all of my patients living to 100. I think that that's something completely out of my control. But I want them living their lives, which is with as much value as, somebody who has 100 years on this earth would experience. So we kind of settled in and fell into the Centenarian Project as the new name for our podcast. We redesigned the logo. We went in with a sugar skull, which, a little bit ironic for a podcast named after an individual that lives for 100 years. But to me, I thought it was kind of a fitting and full circle way to describe it, because if you're appreciating the reality of death, right, which is what the sugar skull stands for, then each individual day that you're spending on this earth is going to be as fulfilling and as beautiful and as satisfying as possible, which is what we want. We want you living to 100 and taking risks and doing fun things and being able to have the freedom to partake in what you want to partake in. So,
yeah, I like it. I mean, who knows who's going to live to 100? But it should be the goal, I guess, or at least trying to be making decisions that are leading towards being in a good shape, as better shape as possible, being pain-free in those years leading up to that. And I think that mindset drives the decisions and the advice that we make clinically, and how we want to help people and what we do, what we say, what we think, all of that stuff that we do towards helping someone should be with that longevity mindset in mind. So I think it's relevant to me. I think it kind of sits at the core of what we do, and it works.
Yeah, and that doesn't, it doesn't mean that I don't want you going out and going skydiving or going on a jet ski or, God forbid, freaking World War III breaks out. I don't want you to not go and fight and defend your country because you have this ideal in your head that you'd like to live until 100. It's more of setting up the conditions on a day-to-day basis to where you could live to 100, right? Like, you shouldn't wake up and be like, what can I do to ensure that I survive today, as much as, hey, what can I do to get every bit of juice and sweet nectar out of the day? Because, living in fear of when the hatchet will fall is not an appropriate way to live. And, you get all these interesting interviews with 100-year-old people too. And it's kind of interesting, right? They're like, what's your secret? What's your secret to success? And you get that old lady that's from the Bronx in New York, and she's like, well, it's one can of Budweiser and a pack of Marlboros a day, right? Like, that's, you know what I mean? Like, that, it's the mindset that I want you to have, as opposed to living in fear, right? Yeah, take care of your chronic joint pain because it's fixable with the right individual, and then go out and enjoy life. Consume mostly whole foods and unprocessed foods, but don't let that ever prevent you, assuming your metabolism is in a healthy shape, from enjoying a piece of cake. So it's that balance between living to 100 and respecting and not fearing death, which I think we accomplished very appropriately in the rebranding.
Yeah, in Australia, at least, or in the Commonwealth countries, if you live to 100, you get a letter from the Queen. So that's something for everyone to aim for. Yeah, I think she's
I
about
don't know if
94.
she's gonna write a letter to herself. Dear, what is Elizabeth, right? Dear
Yeah.
Elizabeth, love Elizabeth. I don't know what you get if you live to 100 in the States. You probably get like a gold-plated 357 Magnum or something like that, where it's just like, congratulations, America. That's not true. I don't condone gun violence or anything like that. It's just it's an American joke. Sometimes we're easy to pick on.
Yeah, look, as we get older, the one thing that we want to maintain is our mobility and our movement. And so if we can get towards those older ages with our joints in the best shape possible and maintaining our movement and still being able to do that, then we're in good shape. So
right, and there's a difference between doing Fran once every 6 months to test your fitness because you don't fear that pain, and doing Fran every week because you're a pathological asshole, right? Like that's that balance that you need to strike to live to 100. If you sit in your room all day covered in bubble wrap, you're dead at 65 too, So again, it's that sweet middle ground that we want to strike, not only with the tone of this podcast, but with everything that we recommend to our patients.
So there it is, the Centenarian Project. If you're watching this on YouTube or you've pulled this down from iTunes, Spotify, you're going to see the new logo that Dr. Mike's put together. So there we go. We're moving forward. We still are bald. We still are bastards. We still love that, but we're moving on. So
we're still two bald bastards, but we've just rebranded. You know what I mean? It's life.
There we go. So we're going to dive into this week's topic, and we're going to talk a little bit about rehab exercises, strengthening of an injury, and how that fits on a continuum of getting better from an injury. So there's different change of thought out there, different approaches around this. It's something that I see sometimes when people land in our office. The advice that they may have had before they've arrived with us sometimes differs to what we would prescribe in terms of where rehab fits and the timing around that. So we thought we'd just explain our take on that today and how we use rehab and where that fits in terms of recovering from an injury. So Mike, do you want to kick this one off? Let's go.
Yeah, for sure. The most common question that I get asked from patients, during my day-to-day visits is, what can I do? What can I do? What exercise can I do at home? What can I, it's, to me, patients have been, I don't know if brainwashed is the right word, but at times they've been led to believe that they can do more to fix their issue than they actually can, right? Which is why you and I have jobs, right? You and I stay wonderfully and beautifully employed, because there are things as a patient that you can't do to yourself. There are things that even if you could do to yourself, you wouldn't be able to do as good a job as we can. And I think the prevalency of rehabilitation exercise in the chronic pain relief realm is more of a function of healthcare practitioners being unable to fix people themselves and saying, okay, let me throw 15 fucking exercises at you in the hope that one unloads your tissue in a perfect way that we strike gold. So that's my big problem with rehabilitation in the chronic pain world. But at the same time, there are instances and there are uses for it that are very real and very practical. It has to be with the right patient. It has to be at the right time in the treatment plan. They have to be feeling the right things. And I'm saying this coming from a CrossFit rehabilitation background, right? That was the way that I tried to fix people for a really, really long time. And you can get people out of symptoms with rehab. But it's not unless you put that rehab at the right point that you really, I don't want to say, you really safeguard somebody from experiencing more pain in the future. Does that make sense?
Yeah, it does. Yeah, I think for me, it really comes back to, it's very simple. You can't make something strong that isn't healthy yet. So, you know, a big part of what we do is finding tissue that's unhealthy, making it more healthy through manual treatment, and then getting it to a stage where we can actually make it strong. And so I think this process gets flipped around too many times, where that getting strong is kind of front loaded, and we sort of just think, you know, we're not actually doing that work up front to make that tissue healthy first. So I guess the order just gets out of whack, right?
Yeah, I don't think people even address the actual health and function of the tissue enough in the first place. So yes, some people, the order gets out of whack, but some people just don't pay enough attention to the actual tissue extensibility or flexibility of a given muscle. So yeah, if you're strengthening and then inducing flexibility, then you've got the order wrong. If you're just giving strength work, then you're just an asshole. Like, truthfully, you just don't understand what's going on well enough. And that doesn't mean that I understand everything in the perfect way, but it's just the way that it goes. If you think about it from a developmental standpoint, right? You're a baby and you've just been born. What do you have more of? Tissue extensibility, so flexibility, mobility, or do you have more strength? So let's use that to guideline the order of operations, fucking the PEMDAS and shit of chronic joint pain, right? So you have all the flexibility in the world as a baby. Let's get you all the flexibility in the world back, and then let's develop that flexibility, right? You possess right out of the womb the ability to get into a half kneeling position. You possess out of the womb the flexibility to get into, what is it, the prone 3-month position, to lift your head up. You possess all the flexibility to crawl, walk, run, throw a baseball 90 miles an hour, right? Knock heads with somebody on a fucking rugby field, or hit a cricket a million fucking meters or yards or whatever the hell the unit of measurements you guys use down there, but you don't possess the strength. So that's how you should be fixing people, because that's how you develop.
Yeah, and then life sort of gets in the way, and these things start to change, right? So as children get older, they start to sit in chairs, they go to school, that sort of thing, and postures start to change and positions start to change, and then, you know, then that flexibility starts to change as well. Yeah, I think, you know, one of the things that I sort of see coming in sometimes is just the message, colloquially sometimes is a bit wrong. I think, you know, how many times have you had someone come into clinic, low back, like a low back sort of case, for instance, a long-term low back case, and there's a perception, because of what they've been told before, that they just need to get a stronger core. I've got a low back pain that's forever because I've just got weak core. And core is perceived a lot of the time as abs, right? So let's
the fuck does that even mean? You know, like, yeah. Once core, what are your glutes, your abdominis, your transverse abdominis, your internal obliques, your external obliques? It's a psoas a part of the core. Lumbar erector is a part of the core. QL. What are we talking about? Diaphragm. What is the core that is so weak, right? If your core was legitimately weak, and sorry, I just cut you off, you'd be a fucking pile of bones.
Yeah, pretty much. So it's a big thing, but you know, you can get away, I guess, with just saying, oh, you've got a weak core. And people accept that because it's, you know, it's a very prevalent explanation.
Yeah, you hammer enough people by telling them that their core is weak, so that when I have back pain, the doctor says my core is weak. When you have back pain, the doctor says your core is weak. We go, oh yeah, our doctors say the same thing, right? It's just, in my 4 years of practice, I've legitimately had one individual that's come in that had a core, quote unquote, that was too weak to support her activities of daily living. She also had a 50% function lower back. So once I fixed that, then we implemented a little bit of breathing and core strength and hip lifts and good morning. So that was one time out of how many low back patients I see over the course of my career.
Yeah, most of the low back patients that we get come in, there's functional movement issues within the small ranges of motion in the low back. So generally speaking, the small stabilizing muscles and tissues that need to be able to lengthen and open to allow movement to happen, they're in pretty bad shape. And so to actually, for us to actually go and assess that and to feel through there and to look at what they can do, they're not moving well and they don't feel good. They don't feel healthy. And that takes work to reset that, to get that to feel better, to actually move better, to actually do what it's supposed to do. So, there's work that needs to happen to actually get this range of motion happening again. And we want range of motion. We want pain-free movement before we actually try to lock those changes in and make it stable again. Just from a tissue pliability point of view, if you imagine what a nice, juicy, raw steak feels like to touch,
It's dinner time here in New York.
It's very soft. It's easy to compress. You can almost kind of pull that apart. It's very, very pliable, very compressible, versus a meat that has been overcooked and it's very hard and it doesn't compress well. It's almost got this very dense kind of quality to it. That's more at the end of, that's kind of more what we see in these chronic presentations. These tissues, they don't compress well, they don't move well, they can't lengthen, they can't open, they can't contract well to be strong. And so it's through the work that we do to kind of reset that back more towards that healthy kind of raw steak, to use that analogy. We want to get it to that point where it feels better. It's much more pliable, it's much more compressible, and then it's in a state to actually start doing some strength work and becoming stable and strong.
Yeah, I mean, your lower back muscles are literally tenderloins, right? So if you've seen a nice beef tenderloin, right, like that's your lower back right there. One time I was breaking down a human being in an anatomy lab and my stomach growled because I saw their lumbar erectors and I was like, damn, that looks nice and tender. But yeah, to put it as simply as possible, you shouldn't be doing strength work in your core unless your lower back is at least 85% flexible. At least. And most people don't know how to actually measure that flexibility. We do, but you have to have that number and say, okay, now you're 85% flexible. Your symptomatology is down, right? You're only experiencing 1-2 out of 10 pain. In a perfect world, you're not experiencing any pain throughout that range of motion. And now we can look to start loading those structures because we've essentially kneaded the dough. We've set the dough, and now we need to throw that bread in the oven, right? We're talking a lot of food analogies today. We're fucking hungry. But that's what you need to do, right? Is you need to set that tissue up to where you can lock that tissue in functionally. But you can't strengthen dysfunction. You can't strengthen a tissue that doesn't lengthen. First of all, you're not going to get it as strong as you possibly can. Secondarily, it's just going to make things worse, right? There's a reason that bodybuilders, right? You talk to like a pro fucking bodybuilder with their card and they go get soft tissue work done. They get ART work done because it enables their tissues to lengthen and contract through a fuller range of motion, thus enabling them to get a better aesthetic, right? We've had that bodybuilder before come in, say, hey, I'm locked up. Unlock them, and they build better aesthetics because their muscles are healthier. And that's one thing that gets lost with chronic pain is you can't look at a muscle and be like, that's healthy, right? You can't look at somebody walking down the street and go, yeah, she's got real healthy quadriceps. I mean, you can if she's wearing shorts and whatever. But,
Booty
that's
shorts.
what you need. They have to be free of adhesion. They have to have full flexibility in order for them to be as healthy as possible. When they're as healthy as possible, then they actually can contract and do the work that they were set out to do.
Yeah, and when this is done right, when this order's right, when the strength and the rehab comes in at the right time, the results are, it's almost shocking. I think the report that comes in for, like the next check-in with that patient after they've started doing that rehab, maybe for a week or 2 weeks, and then they come back and give you the report on where they're at. Usually there's been a big change in that week, because it really, that functional strength and that movement and stability that comes in around that, it's going to lend itself to a big change in just daily activities, because the range of motion's there. We've got that at least 80-85%. And then to start locking that in, usually the report card that comes back after that is awesome. At least that's what I found.
Yeah, and they develop confidence in doing the things throughout the day that would typically cause pain. To me, I'll specifically get that report card where it's like, oh, my wife, husband, partner, whatever it is, was like surprised at how fast I got out of bed in the morning, or we walked through the mall and I was surprised at how fast I could walk without pain. So it's just those little things like that. I'm not afraid to bend over and pick up a pair of socks off the floor anymore. It's just little, simple things like that. Oh, I actually feel good, or oh, I actually was able to ride my bike. Oh, I actually could hike up a mountain. It's like, yeah, actually, I fucking knew what was going on. That's why you can do what you're doing.
Yeah. Look, I mean, this whole, when this process is done right, when this, this continuum is in the right order, then we're on this centenarian kind of idea, right? Because what we're actually doing is we're getting these joint mechanics in the best shape that they can be in, and then we're kind of locking in that changes. So ideally, we're setting that up so that you may not need us again for quite some time.
That's the plan, right? That's the plan. Is let's get you better, and let's go out for a fucking beer, right? Like, that's what I want to see. I want to see you at the bar or the restaurant with your mask on. Hey, let's be safe. But that's where I want to see you. I don't want to see you in my office again. Period. Depending on the type of individual, we may need to see you again. If you're severely degenerated, if you have metabolic conditions, if you're a stress case, yeah, you're going to need to come in every 6 weeks to 8 weeks, whatever, just to get cleaned up. But the vast majority of healthy, relatively young individuals, you don't need to see me anymore.
Let's talk about like what happens if we just dive straight into rehab. So we're sticking with this low back idea. So if we have a chronic sort of low back case in, it's been a lot of episodic pain over a number of years, flare ups here and there. Maybe tried a few different things. Somewhere along that path, they've been told that they have a weak core, need to do more core work. The core is kind of interpreted as doing sit-ups, so maybe doing some sit-ups and potentially making that back pain worse. What could have happened to that person if that approach is just to do rehab straight from the gate, without actually getting in there and getting the range of motion back, getting that full and pain-free, and then locking it in? What are the consequences potentially for that person if they're just taking a rehab approach right from the start?
There's two things that happen, and they both interplay with each other. The first one being that you can overload that area with so much proprioceptive feedback, right? So you can contract those tissues enough to where it just dulls out and numbs out the pain, and the patient feels fixed. They say, wow, I'm done. You discharge them. Everything's good. Everything looks good. Your pain's nice and low. Your core is getting stronger. Boom, discharge. Didn't really fix anything. Another episode happens 3-4 months down the road. The real danger to that is the problem that you haven't sorted out is now going to perpetuate a longer term, more permanent problem, right? If by just loading it up with rehab work, you're not actually decompressing the spine. You're not actually fixing the health of those tissues. You're causing more perpetuation of adhesion. You're causing more perpetuation of degeneration, degenerative disc disease. You're increasing your risk down the road of developing a disc herniation, protrusion, sequestration, something seriously to go wrong. And there will come a point in the life cycle of your lower back that can't do anything, right? Like, that's it. This is your chronic pain. And you know, it's going to be there forever unless you want surgery. And if you get surgery, it might not be there forever. It's just going to be there forever in a different way.
Yeah, the consequences can be pretty bad right at the end of that continuum, right? And you know, everyone's going to fit at some level within that. But yeah, it's super important to get this right. You know, I've experienced this myself. I've been on the back pain continuum. I'm still on the back pain continuum, but I'm at a better place within it at the moment. And you know, it is super important to get in and actually to measure these things and understand where you're at, and then be able to make decisions from there. And you know, I'm young relatively. I'm still in my 30s. If we're talking about trying to live to 100. You know, I want my spine to be able to last, and I want to be able to do things pain-free. And there's some things that you know, are kind of out of scope for me now because of what I've got going on in my back. But, you know, if I can live a pain-free life, I'm good. Like, I'm happy. But, you know, until you actually get in and actually understand what you're really dealing with and understand how it's moving and what shape it's in, it's all guesswork.
I have a serious morbid question for you. What would you rate your back pain 1 out of 10 right now?
Sitting here right now, I'm pretty good. It tends to come with postural change or with unexpected sort of change. Yeah, it's a little bit hard to predict, but right now I'm good.
How long would you want to live if your lower back progressed or regressed, excuse me, at 1% to 2% for the next however long? Let's say 100, like, so let's say 70 years, right? Let's stick you in that centenarian thing, right? Like, what's your will to live with kind of insidiously degenerating lower back pain, right? I mean, it's a morbid question, and it might be more rhetorical than usual, but it's like, there'll be a fucking number where you just don't want to deal with it anymore, right? Where it's just like, it's going to ruin your life. And
yeah, I think I can only kind of answer that based on what I've experienced already. And when it's bad, it's bad. You know, I do remember a few years ago going to bed at night and actually not really, like, I was dreading having to get up the next morning. I was tired. I wanted to go to sleep. I wanted to have that rest, but I was fearful of the next morning because I knew how bad it was going to be to get out of bed. Like, it was terrible. It was some of the worst pain that I've ever experienced, and it was shocking. You know, avoidable, probably yes, on several different levels. But yeah, it's bad. It's life changing. In a not in a good way. So yeah, you know, that's why this is so important, because people, you know, I dealt with that at that level for probably a short time, but there's a lot of people that deal with that all the time.
Right. And you're in a lucky position where, you know, we'll say your back is 8 out of 10 health, or what's your back function? What's your quadruped lumbar flexion last time we checked?
Yeah, about 75%.
Okay, so 75%. You're in a position where you can keep your lower back at 75% for longer or a more substantial period of time because your back is free of adhesion, right? You won't get a 1% change in a degenerative way because you know what's going on. And in that case, your back at 100 years old at 75% function, right, is going to be better than every single lower back on a centenarian on the planet, right? So it's like that then emphasizes how even though you've fucked things up until this point, you have a position to I guess slow down your rate of degeneration such that you're in a better position than most people at whatever age you decide to measure it at.
Yeah, and to bring some relevancy to the topic today, for me, I tend to feel better when I really focus on working in strength and stability into my core. But the whole lower back complex and keeping that strong and stable. And that's because it's ready for that. Like we've done the work to build the tissue health. And so I can do that. I can go in and make that strong, and it gives me control over that region within everyday tasks, because, maybe one day I'll bring up the images. We can put the x-rays up on this screen, and it's fucked. It looks terrible. There's almost no disc left at L5S1. And it's kind of shocking. You look at it and you go, that you must be in pain. And no, not really. Most of the time, that's okay. But it does need to be stable. It needs to be strong, because functionally it's fairly unstable. And so that strength work needs to come at the right time, right?
Right. And for you, your back maybe 75% compared to every other human being on the planet, but for you, your soft tissues are 100% for where you're at your point in your life, right? Like there's no adhesion, or there's very, very minimal adhesion in your lower back. And we measure function to determine the health of a tissue. And we know that your tissue is the healthiest that it's ever going to be at this moment. And it can't be any healthier, because there's nothing bad in your like I fucking felt your lower back, right? So yeah, that's where you then go and look to implement rehab. The tissue has to be healthy, your version of 100% health. Now you go and stabilize that complex, and voila, pain-free.
Yeah, what's there is there.
Right.
We can't change the structural stuff, but we can affect the functional.
Correct.
And so that's where this the strength, the rehab, the stability, that's where it has such an important role. So it certainly does have a very important role. This episode today is not to downplay the role of it at all. It's just about getting the sequence right and fitting it into that continuum at the right point, and making that call to insert it at the right place and the right time in someone's treatment plan.
Yeah, not using rehab as a crutch to cover up your inability or unwillingness to treat an actual structure and to improve flexibility and the health of a tissue.
All right. What a way to wrap it up today. I think that sounds good to me.
It's a beautiful thing. Episode 12. We don't know what the name is going to be, but it's going to be something great.
We're episode 12, and I guess you could say we're episode 1 of season 2.
So yeah, we'll change seasons. Why not?
We'll see how we go. All right, folks. Well, it's been fun. We hope you enjoyed it.
Have a good one, guys.
See you soon.